New tonight, the state's laying out an action plan to address high levels of nitrates in drinking water across southeastern Minnesota.
We're talking about these 8 counties in what's known as the Karst region of Minnesota. The Environmental Protection Agency ordered the state to address the problem, and the deadline is Sunday.
Richard Reeve reports on the growing health concerns and the plan to make the water safe.
Jeff and Erica Broberg drink bottled water these days.
So we stopped drinking our water. That was some 20 years ago.
A couple concerned about high nitrate levels in the water at their Winona County farm.
We bought our farm in 1986. It had 8.6 parts per million nitrates then. Every time I tested it afterwards, it was higher.
Broberg says that level now is about 22 parts per million. The EPA says the safe drinking water limit for nitrates, which can come from runoff from fertilizers and animal waste, is less than half that.
Started hauling our water. We hauled our water weekly from a friend's house in St. Charles where they have water that's tested and we know that it's pure.
But now, a month after this EPA directive calling for the Minnesota Pollution Control Agency and the state health and ag departments to address nitrate pollution in the Karst region, the agencies have come up with an action plan that includes notifying private well owners that they have high nitrate levels and providing them with alternate water sources, ensuring safe drinking water for private well users. The state says it's also working on a long-term plan to reduce nitrates in aquifers that provide drinking water.
So nitrates are an acute contaminant, which means that even short-term exposure can put people's public health at risk.
Carly Griffith is with the Minnesota Center for Environmental Advocacy, one of 10 groups that asked the EPA to step in. Her concern that high nitrate levels could increase risk of colon, kidney, and stomach cancers, and that private well owners need help to ensure their water is safe.
With private well owners is they don't have any of the regulatory support that people on public water systems have. So it's up to them if they want to test their water supply.
Griffith says the state needs one coordinated approach to deal with the nitrate issue.
So I've had diabetes, and a month ago I was diagnosed with type 3 chronic kidney disease.
Meanwhile, Broberg now wonders if his health has been affected by the water he's drunk.
I don't know if they're lifestyle choices or our water, but I hate to think that future generations would have to worry about it.
And the EPA says more than 9,200 residents in southeastern Minnesota are or were at risk of consuming water contaminated with nitrates. Part of the state plan would provide vouchers for bottled water for vulnerable populations, including pregnant people and infants under a year old. Now, in its letter to the EPA, the state says it expects to have a complete plan in place by mid-January.
Okay, Rich Reeve, thank you so much.